So this is the classic case of Dandy-Walker spectrum. Midline analysis using the sagittal T1 weighted MRI shows the classic findings of this case, Dandy-Walker with a large posterior fossa cyst, high torcula, and a small upwardly rotated vermis. There is also a significant commissural anomaly with only a small corpus callosum remnant present. The rostrum and splenium are absent. The anterior commissure is present and appears normal. On the right image, we can see that this is T2 weighted MRI, and it shows that the fourth ventricle is open dorsally, contiguous with the huge posterior fossa cyst. Now, in these two images, we can see that on the left side, that's the sagittal sequence of T1 weighted MRI, and it shows a hypoplastic callosum, rostrum, and splenium, plus a small interhemispheric lipoma. And on the right image, that's the T2 weighted image from T2 weighted MRI of the sagittal sequence, and shows a very small posterior fossa with a low-lying torcular and an elongated fourth ventricle that lacks a fastigium. This patient has a classic ctitus malformation. In these images, we can see that on the left side, that's the midline analysis of a sagittal T2 weighted MRI. It shows a normal-sized posterior fossa. The cerebellar tonsils are pointed and displaced inferiorly, almost 1 centimeter below the foramen magnum. Note the cord hyperintensity, which is suggesting a pre-siring state in this case of classic ctitus 1 malformation. In the right image, we can see that that's the axial sequence of T2 weighted MRI, and it's the same case, and it shows the mass-like thickening of the right medial parietal gray matter and distorted sulcal gyral pattern of cortical dysplasia. So these are the axial slices of on the left side, that's a non-enhanced CT scan in an 18-year-old male with seizures history. Shows a unilateral schizencephalic cleft extending from the pile surface of the brain to the ventricle. Note the characteristic CSF nipple at the ventricular margin. The cleft is lined by thickened dysplastic gray matter. In the right image, we can see that that's the axial T2 weighted MRI, and it shows bilateral schizencephalic clefts which are lined by dysplastic gray matter. Note the abnormal cortical veins associated with the clefts. In these images, we can see that the image on the left is actually the axial T2 weighted MRI, and it allows analysis of the midline and shows absent interhemispheric fissure in the frontal lobes. The white matter is continuous across the midline. This finding, plus the absence of frontal horns, gives the diagnosis of holoprosencephaly. On the right image, we can see that this is the analysis of coronal images and shows a squared-off appearance to the lateral ventricles with inferiorly pointed frontal horns. There is absent septum pellucidum and hypoplastic optic chiasm, which is characteristic of septo-optic dysplasia. In these images, we can see that the image on the left is the midline analysis of posterior fossa structures, and it shows an upwardly convex superior fourth ventricle and a dysplastic appearing vermis. In the right image, that's the axial T2 weighted MRI in the same case, and it shows the elongated fourth ventricle, cleft vermis, and thickened horizontally oriented superior cerebellar peduncles, forming the classic molar tooth sign of the Juberg syndrome. So this on the left image is the sagittal graphic, and it demonstrates the pointed peg-like tonsils which are extending below the foramen magnum, elongating the normally positioned fourth ventricle. In the right image, that's the sagittal sequence of the T2 weighted MRI in a 23-year-old male with the classic ctitus 1 malformation. It shows low-lying pointed tonsils and hyperintensity in the upper cervical cord that may represent the pre-siring state. In these images, the image on the left is the sagittal T1 weighted MRI, and shows normal fourth ventricle position and appearance as well. The fastigium is in normal position, which is helping to distinguish from the ctitus 2 malformation. There is inferior displacement of the ectopic cerebellar tonsils through the foramen magnum with odontoid process, retroflexion, and clevis foreshortening. The right image is the axial T2 weighted MRI, and it confirms the inferior displacement of the ectopic cerebellar tonsils through the foramen magnum, producing the foramen magnum crowding. So in this image, we can see in the left image, there's a sagittal T1 weighted MRI of osteopetrosis, and it demonstrates the severe cerebellar tonsillar ectopia with extension of the elongated cerebellar tonsils into the upper cervical canal to the C2, C3 level. Hypointense marrow signal reflects the diffuse sclerosis. In the right image, there's the axial T2 weighted MRI sequence, again of osteopetrosis, and it reveals the characteristic crowding of the foramen magnum, which is related to the CN1 with extension of the ectopic cerebellar tonsils into the upper cervical canal. On the left image, there's a sagittal T2 weighted MRI, and it demonstrates severe cerebellar tonsillar ectopia. The tonsils produce deformation of the upper cervical spinal cord and abnormal cord T2 prolongation, which is reflecting edema and potentially an early pre-siring state. The right image is the axial T2 weighted MRI sequence, and it reveals the caudal extension of the ectopic cerebellar tonsils into the foramen magnum, completely effacing the basilar cisterns and displacing the adjacent spinal cord. So the left image is the sagittal T2 weighted MRI. It depicts the marked cerebellar tonsillar ectopia with normal tectum and fourth ventricular position. The clivus is mildly foreshortened and the dens is retroflexed. There is central intramedullary edema in the cervical spinal cord without frank syringomyelia, a finding that has been described as a pre-siring state. On the right image, we can see that that's the axial T2 weighted MRI, which confirms the displacement of the ectopic cerebellar tonsils through the crowded foramen magnum, producing the foramen magnum crowding. So, coming towards Chiari-2 malformation cases, in the left image, we can see that that's the sagittal graphic of the posterior fossa and upper cervical spine, which demonstrates the characteristic findings of Chiari-2 malformation, including the callosal dysgenesis, the tectal beaking, the small posterior fossa, Wormian ectopia, and medullary kinking. The right image shows the sagittal T1 weighted MRI sequence. It shows the characteristic Chiari-2 malformation findings, that is the tectal beaking, the Wormian displacement through the foramen magnum, the large massa intermedia, and the dysplastic corpus callosum. In these images, we can see that the left image is the sagittal T2 weighted MRI, and it confirms the characteristic findings of Chiari-2 malformation, again including the tectal beaking, the Wormian displacement through the foramen magnum, the towering cerebellum, the large massa intermedia, and the dysplastic corpus callosum. The right image is basically the axial sequence of the same T2 weighted MRI, and it shows the characteristic posterior fossa crowding at the foramen magnum, reflecting the small dimensions of the posterior fossa, combined with cerebellar ectopia and Wormian displacement through the foramen magnum. The left image is a sagittal T2 weighted MRI of the brain. It shows characteristic Chiari-2 findings with the very small posterior fossa size, very small posterior fossa size, prominent tectal beak, and Wormian tonsillar extension through the foramen magnum. The corpus callosum is severely dysplastic, and the ventricles are small following the CSF shunting. The right image shows the axial T2 weighted MRI sequence, and it depicts the enlargement of the occipital horns of the lateral ventricles, which is called colpocephaly, related to the callosal dysgenesis in conjunction with peak tectum. In these images, we can see that the image on the left is the axial T2 weighted MRI at the posterior fossa level. It demonstrates the classic axial image manifestation of the towering cerebellum extending through the wide tentorial incisura. The right image is the axial T2 weighted MRI, which is performed at the foramen magnum level, and it depicts the characteristic crowding of the inferior posterior fossa. Both of the cerebellar tonsils as well as vermis are inferiorly displaced into the foramen magnum. In these images, we can see that these are the, on the left side, that's the sagittal T2-weighted MRI, and it depicts the marked Wormian ectopia and prominent medullary kink, which is positioned lower than typically seen at the C4 level. Note also the dysplastic beak tectum and the prominent massa intermedia. The right image is a sagittal T2-weighted MRI and shows crowded posterior fossa with Wormian ectopia, large cervicothoracic cord syrinx, as well as sizable focal cervicomedullary syrinx, which is called syringobulbia. Note the hyper-intense gliotic changes of the scarred pumice. Now, coming towards the Chiari-3 malformation cases. Now, the image on the left is basically the sagittal T2-weighted MRI, and it reveals a large defect in the ventral chondral portion of the supraoccipital bone and the opistheon of the foramen magnum. The gliotic cerebellar tissue is protruding into a large sac. Also note the displacement of the brainstem and basilar artery. The image on the right is basically the sagittal T1-weighted MRI, and it shows a large meningoencephalocele which is composed of meninges, CSF, and cerebellum, brainstem, and upper cervical spinal cord herniating through a bone defect in the lower occiput and upper cervical spine. In these images, we can see that the image on the left is actually the bone CT 3D shaded surface rendering of the posterior calvaria / upper cervical spine in a Chiari-3 malformation patient, and shows a large defect of the ventral chondral and squamous supraoccipital bones in conjunction with the upper cervical spina bifida. The sagittal MRV demonstrates the typical venous abnormalities of Chiari-3. The straight sinus and the vein of Galen is severely hypoplastic. The large occipital sinuses rather than transverse sinuses are present. So now these are again the image on the left images from this is the coronal graphic. The image on the left is coronographic and shows a lack of transverse corpus callosum and separate lateral ventricles. The interhemispheric fissure extends to the third ventricle. The bundles of Probst contain the parasagittally rerouted callosal fibers. The image on the right is the coronal T2-weighted sequence with callosal dysgenesis, and it shows the Viking helmet or the moose head appearance of the widely separated lateral ventricles. The very hypointense white matter tracts medial to the lateral ventricles are the Probst bundles, and also note the heterotopic gray matter. So the image on the left is a sagittal T2-weighted MRI in the same patient, and it shows the absence of the corpus callosum, the radially oriented gyri converging on a high-riding third ventricle. Also note the azygous anterior cerebral artery. The anterior commissure is also absent. The image on the right is the axial T2-weighted MRI sequence, and it's the same case. It shows the characteristic parallel non-converging lateral ventricles, which are seen in corpus callosum agenesis. Heavily myelinated Probst bundles are seen just medial to the lateral ventricles. So some more images from callosal dysgenesis. The image on the left is the sagittal T1-weighted MRI, and it shows pure partial agenesis or dysgenesis of the corpus callosum, whatever you want to call it, agenesis or dysgenesis. The posterior portion of the corpus callosum is missing, but the junction with the fornix seems preserved. The posterior coronals would show Probst bundles, whereas the anterior images would appear normal. The image on the right is the coronal T2-weighted MRI, and it shows the agenesis of the corpus callosum with shunted interhemispheric meningeal cysts. Also note the massive nodular heterotopia on the patient's right. A Probst bundle has formed on the left but not on the right. Again, the image on the left is the axial non-enhanced CT scan with widened windows, and it shows the agenesis of the corpus callosum with colpocephaly, calcified midline lipoma that extends through the choroid fissures into the lateral ventricles. The image on the right is the axial T1-weighted MRI in the same case of agenesis of the corpus callosum, and it shows the parallel ventricles, colpocephaly, and a midline lipoma. Also note that the lipoma protrudes through the choroid fissure